Hi everyone. So I have come up with a new video in which I'm going to speak about my exam papers, like what was my question in this what we say what was my question in my which exam was this QCHP exam. I was going to say NEET exam because nowadays I'm just seeing NEET exam a lot. So let me just answer the question. I only have 15 minutes to finish this video by the time my driver is going to call me saying that and I'm that. So I just have to rush. So I have time. Let me just make this one video completely and then I'll just go back for my work. So to tell you that what all questions I had in my exam. So the first question was about delayed eruption of 3, 6 and 10-year-old child. So the answers were about dentator cyst, radicular cyst, lateral periodontal cyst, or buccal furcation. So these were the options. So please you can find out the answer by studying all the cyst. Then the second question was about the amalgam daily intake, which was 1 microgram. Third question was about intercuspal distance, which was 1/4 of the intercuspal distance, 1/4 or 1/5, I think it is like that. What gold inlay pain? So what is the reason for the pain? So the patient had a gold inlay and now complaining of pain. So which pain is he undergoing? Is it a thermal pain, radial pain, whatever the pains are there? And the question was about dental varnish. So just read about the percentage. 5% of sodium fluoride was the answer. I just written the answer. I'm not sure about what all options, but this was the answer for dental varnish. White spot after the braces was removed. So what is the reason for that? And what is the treatment? Then comes notch incisor and syphilis, which stage you can see. Then was about Proxa brushes. So it is type 2 embryo was the answer. Juvenile periodontitis, which antibiotic will you use? Options were Metro, Amox, tetracycline, many. So just know about the juvenile periodontitis. Then the question was about taurodontium, then Teacher-Collins syndrome, then about the clasp, till where will you extend, and somewhat like this was the question. Then about denture base. Denture base was the question about the denture base. Then third molar inside the inferior alveolar nerve. What will be the treatment? So the question was like this, but the answer, I'll tell you what was the answer. So the answer is you will not remove that teeth at all. You will leave it as it is. If the teeth is touching the nerve, there is no treatment, no extraction or no crown breakage, only taking out the crown, leaving the roots. No, it should be like you should leave this teeth as it is. Do not do any extraction. Then assessment in PhD. What is the meaning of assessment? So the definition of assessment was there in the question. Then about Avil's teeth stored in which media? So it was fat-free milk, cold milk, and other options. Then treatment for treatment for ossifying fibroma. How will you treat that ossifying fibroma? A notch present on interdental bone is the thick frenum. What will you do? RCT failed. What to do? Re-RCT, under obturation. Why this RCT has failed? So what is the option? They have options are given. So what is the answer? You need to find it out. Then was picture-based question, image-based question. Calcium hydroxide intercanal medication. Which will you use? So it about superoxole for endo discoloration of the teeth. About bleaching is a very important. I think bleaching is the main thing which we are studying. So bleaching is a major important question which has been asked. So read about bleaching. Okay. Then let me just read this again. Okay. Uh, okay. Pain when you touch your face. So what is the reason behind that pain? It could be due to trigeminal neuralgia. So it's a main feature. The pain is pain in your face when you touch it. It's trigeminal neuralgia or Bell palsy. So this was the question. So study about trigeminal neuralgia. Pinpoint exposure in the rubber dam. So what treatment can you do in that? Direct pulp capping, indirect pulp capping. I don't know about this. Just read it, okay? Then comes lingering pain, recurrent caries, cold. I don't know what is this answer, but this is what I've written. Irrigation is done to remove microorganism. Vital teeth apex is not formed. It will do apex. I don't know. So irrigation is done to remove what? So why do we do irrigation was the question. Enamel bonding agent. What is the enamel bonding agent? And filled resin hybrid layer indentine bonding agent. So study about enamel bonding agent. Triple antibiotic medication. So how will you give it? 2 weeks. Aminocycline, metrocycline, cefixin. So you just read about these medicines, about triple antibiotic. Vasodilation is vasodilation most prominent. Read about it. Drill in the plate for fixation. So how much drill you will do for the fixation in the plate? So 0.5, smaller than the implant. Clicking of the posterior teeth in the CD patient while speaking. So what is the reason? Increase vertical dimension. Antibiotic during extraction. What antibiotic will you use? Then was about MI. Then arterial fibrillation. Then was about scaling. We use piezoelectric scaler. In scaling, which scaler do we use? About that. That 5 years. Then 5 years left central incisor missing. What will you give? I don't remember this, but this is what the question was. So, about 5 years old, dentine is formed by which cell? Uh, pedo have amalgam restoration on X-ray shows multiple pulp exposure, no pain seen. What will you do? What about avulsion? Avulsion. Then health assessment and PhD. Chronic suppurative periodontitis, pus sinus, swelling is seen. Antibiotic, incision and drainage. What will you do? Then crown, but no symptoms. Healing is good and the root development normally. So what will you do? Fracture in the middle of the root. What will you do? Extraction of the inferior alveolar nerve, labial mucosa have pain, long buccal nerve. I don't know what was this question, but it was about inferior alveolar nerve. Avulsion media, cold milk, low fat milk, and option like that. Angle former for given angle. So this is also a very important question. Then comes intercuspal is used to remove GP and post core. Veneer is bonded with the light cure resin for the color match. Bacteria in the formation of PDLA, A gingivalis. So I'll complete this later because it's too much. Now I just have to go because the driver is waiting down. As I told you that he will update me and he's really waiting down for me, so I have to rush.